Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Today we're going to talk about an important topic, and that's how to prepare for a blood test and why it matters. Blood tests are crucial, of course, for monitoring our patient's health, but its preparation can make a huge difference in getting accurate results. First, let's discuss fasting. Now, you might have heard and you know that we tell patients to fast, but fasting means not eating or drinking anything except maybe some water for 8 to 12 hours prior to this test. But in a typical wellness panel, there's only 3 things that will be affected by non-fasting. That's the fasting blood sugar, obviously, an insulin level, and the triglycerides. Typically, the others are not. Diet and hydration. For instance, dehydration, we talked about it before or last time. It can make your blood thicker. It can raise your BUN and mimic kidney issues, which it's not. To avoid this, you stay well hydrated. You definitely make sure that patient does not drink too much caffeine and alcohol because these are dehydrating as well. Make sure the patients don't use a lot of medications and supplements. Some of them can affect the test. Biotin, for example, can affect hormone tests and lead to inaccurate results. And even exercise and stress levels, because intense physical activity will raise certain markers like C-reactive protein, also CPK as a muscle protein. So try to avoid these strenuous exercise for about 24 hours, tell your patients. And remember, stress does affect the results, especially like cortisol. So ask the patients to, if they can, get a good night's sleep and relax as much as possible. Now let's delve a little bit deeper into some additional pre-analytic factors that might influence these people's blood test. Some of the factors are maybe not as obvious, but they can have a significant impact, such as the biological variability. We've also discussed this previously. Many hormones, cortisol, melatonin, will follow circadian rhythm. So depending on what time of day you're drawing this, including testosterone, will affect the results. Menstrual cycles will also play a role. Hormonal fluctuations during that cycle affect the levels. For most, it's pretty much understood. Age and gender consideration are also important. The normal reference ranges for many tests vary upon these factors. And environmental factors. If you live at high altitudes, your patients are having increased red blood cell counts to account for the loss of oxygen by compensating by increasing hemoglobin levels. Temperature can also affect the stability of the blood components, especially if your staff's not handling the specimens properly. And there's other things like tourniquet being applied for too long during a blood draw can lead to hemoconcentrations. And that can basically change what the process or the findings are. If you delay processing, spinning, this too can affect it. And of course, contamination's another concern. Some people don't think of this, but there are IV clinics that often draw the blood after giving the IV, and these will create inaccurate factors. Lifestyle too has an impact. Of course, smoking because of carboxyhemoglobin that can affect the white blood cell counts. The triglycerides can be affected, liver function. Even caffeine can transiently change levels, including the homocysteine. And of course, genetic variants can play a role, like Gilbert syndrome. People that have that will have benign elevations of bilirubin all the time. And if someone's just recently given blood donation or has had some sort of phlebotomy, it can cause hemoconcentration and even increase in some of the general inflammation markers like C-reactive protein. Fascinating, right? And there's a lot of factors that can influence our blood tests. However, understanding these and communicating any of the relevant information to your patients may help ensure you're getting an accurate understanding and therefore transmitting to your patients an accurate interpretation. Thanks for listening and take care.